the Speaker has been talking from the beginning about a sunset, as I have. That was one of the things we looked at. The Speaker said that was, one of the more important issues, so there was a compromise again. The sunset's been included and non-imposition's been taken out. Legislation is too important, to get hung up on a single issue, and so non-imposition was an important issue for me. For me personally, I pushed for it, but the Speaker said the sunset was more important for her caucus. So trying to, work with the Speaker, I was supportive of this sunset, absolutely.
And the non-imposition is now gone?
Yes.
And can you explain that, what that would have done?
Well, it's just basically what it would have done is you would prevent governments from imposing a contract. Not that any government has imposed contracts, it just gave them the ability not to impose. So public workers can't strike, and government doesn't have the ability to just say, this is my best offer and here it is. They would have to continue to negotiate, which is not unusual in the public sector anyway. I ran a county government for 14 years, and our contracts didn't get done always on the date they were supposed to get done. So you just continue to negotiate. So, what I viewed as something was important, which was non-imposition. The Speaker's position was that sunset was much more important to her and her caucus. So again, it was a very easy compromise to make. People were talking about collective bargaining. Well, we have in this legislation before the sunset a local option which allowed you to bargain and negotiate as long as you came up with the savings that this health care proposal came up with. That was always part of the bill, but now you have a sunset. So at the end of whatever the final term is, it'll just go into the collective bargaining agreements and they can continue to negotiate. So basically what you have is, for one contract, you're gonna have health benefits increased on you for one contract. And the pension, once this legislation is signed into law, the pension contribution and pension changes take effect immediately. The health care contribution issue, the health care piece, doesn't take effect until after the collective bargaining agreements expire. So if you just went into a bargaining agreement this year and you have a 3-year agreement, that piece will not take effect for, until after 3 years, and then it's phased in over 4. I'm really excited the CWA put out a release today about my numbers being bad. What they did is they validated what I've been saying. Healthcare is going to go up 7% a year over the next 4 years. That's what they said. So that's a 28% increase that they want the taxpayers to eat. Right now, a family plan is $19,000, so I guess they're looking at taxpayers just funding at $27,000. What they didn't put in is that part of this legislation allows employers and employees to create new health plans that actually does something about the cost of health insurance, which will enable us to maintain and control costs and bring them down. So honestly, I was very happy that the CWA pointed out that healthcare costs are going to go up to 28% over the next 4 years, and they want the taxpayers to pay every bit of it.
Are they correct in saying that the grid that we've all received, are they correct in saying that it doesn't take into account the increases each year?
No, they're absolutely incorrect. Listen, we take that into account. That's why we create these new these health boards, to design new plans to help control the cost. We know healthcare is going up each year. They came up with 7%. We could pull any number we want and say that's the percentage. We know they're going to go up. So what they're talking about is doing nothing. What I'm talking about is actually doing something about the cost of healthcare by designing and creating new health plans that control costs. And since the employees are going to contribute and participate in that cost, it's going to drive the cost of healthcare down. So they make an automatic assumption that the employees are going to pay more because they don't recognize that there's going to be new plans in place. And again, they want the taxpayers to pay the whole boat. Up until a year ago, when we did the 1.5%, taxpayers were paying every bit of $19,000 per worker's family health plan. 4 years from now, it's going to be about $27,000. What's their solution? They don't have one. What this does is it puts together labor management boards, like private sector unions have. to design healthcare plans that are less expensive, but provide the care that workers need because they're going to be participating in the cost of the plan.
Is it still, is it still, as per your original plan, minimum of 5 from which to choose? Is that still the same?
It could even be more, Kevin.
But minimum of 5, right?
It's a minimum, I think, 3. It can
Oh,
go
okay.
up to 5. But listen, that's all done by them at a table with management, and it's to their advantage to design multiple plans to control the cost because the employee is going to participate now. But what they don't take in recognition is look at the grid that we did and how we protected the workers on the lower scale that had the least ability to pay. The people on the higher end of the scale are going to pay more to help the lower end workers, survive in this economic time. But realize there's taxpayers that don't have health insurance that are paying these bills. They can barely pay their property taxes. They're losing their houses and their cars, and kids can't go to college. And I wish I was making it up, but it's true. So this is called being fair to everyone. We're being fair to the workforce because the workforce isn't the enemy. By no means. I mean, these are people that work hard every day. And when you go tell people things have to change, well, things have to change. What worked in 1970 doesn't work anymore. So, look, the sunset suspends basically their issue on negotiating health care for one contract. It amounts to one contract. And in these economic times, in the crisis that we're in, it's not unreasonable to ask everyone to step back and help. I understand no one wants to change, but this is not mean-spirited to workers by any means. The funny thing is that I had many members of my caucus say to me that if we got a sunset, it would make all the difference in the world. And now that the sunset's in place, the unions are saying the sunset's not that important. So it's hitting a moving target. And at some point, you got to move forward. We've tried to be fair. We've listened to the workers. We've listened to the unions. But this is not, by any means, a unfair deal. Look, I am one of 2 senators that make their livelihoods from a union. I am. I got 24 Democrats. There's 2 of us that make our livelihoods. I would never do anything to hurt working men and women, especially union people. It's what I do for a living. This is nothing more than I would have for my own members. And this is how my members live. And just because we're private sector unions doesn't mean that we're bad because we're private sector. I'm a labor person. This is not unfair. This is not mean-spirited. And as I've told a few of my members of my caucus, look who's talking about this. The guy that makes his living from a union. I would never hurt working people.